Hello everyone, I'm Dr. Yolandra Hancock. I'm a pediatrician, a public health expert, and a mommy. I'm here to talk about lead poisoning and the importance of lead screening. Let's get started. The first question that we should answer is, what is lead poisoning? Lead poisoning is when too much lead accumulates inside the body. When we get too much lead inside the body through our skin, through breathing it in, through drinking contaminated beverages, and through what we eat. It's really important for children because the younger a child is, the more easily lead can be absorbed in the body. The next question is, where does lead come from? Naturally found lead is in the soil. It's called a heavy metal, but we can also find lead in lead-based paint. Luckily, we no longer use lead-based paint here in the United States. It was banned as of the 1970s, but there's still houses, apartments, and other buildings that contain lead-based paint. And when that paint chips away or when our little ones peel at it and eat it, that increases their risk of exposure. We can also find lead in lead-contained pipes that bring us our drinking water. We can find lead in certain beauty products, certain toys, certain candies, and other foods, especially if they come from other countries. Because lead is naturally found in our soil, there's certain cultures that practice healing techniques with the use of soil that can increase a child's risk of lead exposure. And in the last place that lead can be found is with us as parents, depending on the work that we do. If we're working in areas like being a painter or being a construction worker, those tiny particles of paint or debris that land on our clothes and on our skin can actually be taken home, and our little ones can either come in contact with us and then rub their eyes, their noses, their mouths, or they can actually breathe it in. So those are the ways in which our little ones can become exposed to lead. Now, let's talk about why lead screening is so important. So the younger a child is, the more their bodies can absorb lead. So for little ones who are less than 3 years of age and unborn babies, inside mommies who may be exposed to lead, those are the little ones who are at increased risk of lead poisoning, which is why at 12 months and 24 months, 1 year and 2 years of age, we standardly screen little ones to determine whether or not they have been exposed to lead. We don't want to wait until they develop symptoms because what we know is that when symptoms develop, it's likely an irreversible process. Lead is one of those sneaky things that when little ones are exposed to it, if we don't catch it early, it can cause a lot of damage inside of a little one's body. Because we know that the younger a child is, the higher their risk, what we end up doing is doing a questionnaire. So at the age of 6 months, 9 months, 12 months, 15 months, 18 months, and 24 months, at each of those well baby checkups, your provider will ask you questions about lead risk. So we'll ask questions about what the parents may do for a living, how old the house is, the type of pipes, what kind of dishes you're using, etc., in order for us to know whether or not lead screening should be done sooner than 12 or 24 months. But as a standard, we universally do lead screening at 12 and 24 months, either through pricking a finger or through what we call venipuncture, where we actually draw the baby's blood. All right. Next, we'll be talking about what the results mean. Now, when a little one has a lead test done at either 12 or 24 months or sooner if they're higher risk, what we look for is a lead level of greater than 5. If a little one has a lead level greater than 5, then that means we have to pay close attention to what the risks are inside the house in terms of food, paint, etc. If the lead level is greater than 10, usually the health department comes in to do an evaluation of the home to assess for risk. For little ones with a lead level of greater than 45, which is very significant, that's an indication at 45 or greater that they need to be hospitalized and undergo a process called chelation. That's where there's an agent introduced inside the body to help pull the lead out of the little one's system, because that is an emergency. And the higher the lead level, the more likely damage will happen. So that's sort of how we respond to the lead screenings in terms of the lab levels. Next, we'll talk about what happens when a little one is exposed to lead and develops lead poisoning. Lead is harmful for a variety of reasons. The first being that it impairs red blood cell development. So our little ones are actually at increased risk of anemia when they've been exposed to lead. The other is that it blocks calcium absorption. So our little ones can develop weak bones, weak teeth, and issues with their muscles. The third is that lead can cause damage to the brain and to the kidneys. resulting in permanent damage to each of those organs. Let's talk about the signs and symptoms of lead poisoning. They can be as generic as our little ones complaining of feeling tired, complaining of muscle and joint pain. They can report headaches, nausea and vomiting, loss of appetite, and constipation. When lead is absorbed in the brain, little ones can develop attention issues, lack of concentration, even some learning disabilities. Because lead prevents red blood cells from being produced, they can develop signs of anemia, which include looking pale, having an increased heart rate. All of those things can be manifested as a sign of lead poisoning. They can also complain of a metallic taste in their mouth because of the increased levels of lead. They can also complain of headaches. So there are a variety of symptoms that little ones can present with. It's really important for us as moms and dads to pay attention to what's going on with our little ones, especially if their school performance changes. If your little one's school performance changes, one of the first questions I would ask your provider is, can we get a lead test, especially if they're under the age of 5, all right? Next up, we'll talk about treatment. Let's talk about the treatment for lead poisoning. It really depends on the level of lead inside of a child's body. For lead levels between 5 and 9, it's really about decreasing exposure. The body has an amazing way of clearing lead all on its own, but only when we decrease a child's exposure to lead so that the body has a chance to actually clear the lead from its system. With levels of 10 or higher, we want to make sure that not only do we identify and then decrease the risk of exposure, but we also want to provide nutrition necessary to decrease the amount of absorption of lead. That nutrition includes foods that are rich in vitamin C, foods that are rich in calcium, and foods that are rich in iron. And if you struggle, like a lot of us, to get our little ones to eat those kinds of foods, that's where vitamins and other supplements come in. When a child's lead level is 45 or greater, that's when it's time for our little ones to be hospitalized and allow us to take care of them. They will receive a medication called a chelator, which binds lead inside the body to help the body get rid of it. So usually at a level of 45 or greater is the indication that it's time for our little ones to come into the hospital to receive excellent care. Our goal is really to minimize risk. We don't want any little ones to have a lead level of even 5 or greater. So we're going to work collectively to decrease exposure to paints, to products, and to people who may have lead on their persons. You see how I did that with all those P's? We will do this together. All right? Take care. Thanks for listening.